campaña chilena, no las eliminatorias porque siempre dan asco, sino la campaña chilena contra los fumadores de marihuana, se llama Vuelve a ser inteligente. ¿Quieren verla? ¡Vamos a verla!
Manual para personas bajo la influencia de la marihuana. ¿Cómo ponerse las zapatillas? Primero debes recordar dónde guardas las zapatillas. No, intenta otra vez. Muy bien. Ahora toma el par que más te gusta. ¿No son esas? Sí, esas mismas. Ahora apúntelas. Vamos en los pies. Amárralas. Intenta de nuevo. Muy bien, te felicito. Vuelve a ser inteligente. No fumes marihuana. La marihuana te desmotiva, altera tu memoria y baja tu rendimiento. Un mensaje de CONACE, Gobierno de Chile.
Uy, pero qué jodidos. Siempre es más fácil hablar y no pensar. Estoy enojado. Me voy a desabrochar la bragueta porque se me inflaron los huevos, loco.
Y estas son las vicisitudes por las que debe pasar cualquier usuario de cannabis en tiempos de fanatismos universalistas. Pero no temas, porque esto no te va a pasar a vos. A vos que sos un papá, un padre, un jefe de familia que sale a trabajar desde muy temprano y vuelve a la noche después de que todo el día el sistema y su jefe lo violaron interminables veces en muchas posiciones durante el día. O a vos, que sos una mamá que quiere un mundo con coherencia para sus hijos. O vos, picarón, sí, que sos un estudiante que le gusta compartir el pan con sus amigos y cultivar sus derechos. Córranse todos ahora. O a vos, la abuela, pequeña gran abuela, que a lo mejor estás consumiendo THC porque estás combatiendo el dolor de la artritis, del reuma o el Alzheimer. Esto no le va a pasar a ninguno de ustedes, porque hoy están con nosotros acá para informarse, para instruirse, para reflexionar. Bienvenidos al Informe Psicoactivo.
Hoy tenemos Conrad, autor, curador de museo, consultor, orador público, perito calificado en el tema cannabis. Esta conferencia tuvo lugar en mi dulce Córdoba.
I'm going to encourage Argentina to exercise its rights to protect the rights of the people here. So, a few words we need to know: cannabis, hemp, and marijuana. Cannabis is the name of the plant. Cáñamo refers to industrial use of it. And marijuana is the word that refers to the smoking or using of the flowers. Inside the flowers are about 60 medical compounds. The three most important to us are THC, CBD, and CBN. The picture shows a THC molecule. These active compounds are in the resin of the female flower. It acts with a system inside of us called the endocannabinoids. The history of cannabis goes back at least 5,000 years for medical purposes. And the Romans actually gave the plant the name Cannabis sativa. In 1964, an Israeli doctor discovered THC. Dr. Tav Mikaria was a doctor in the United States in the 1960s as well. Dr. Mikaria took the studies from the previous century and compiled them into the first modern book on medical marijuana. He also worked on President Nixon's commission to discuss marijuana. And when the commission suggested marijuana should be legal for personal use, Nixon said no and ended it. Dr. Lester Grinspoon had a son who had cancer, and his wife secretly went out and got marijuana for their son because he refused to take the chemotherapy treatments. And one day, when the son was going to get his treatment, Dr. Grinspoon noticed he was in a very good mood. And he said, "Why is that? You always hate going to chemotherapy." And when he found out his son smoked marijuana, he got angry. But then he saw the way it gave his son new hope. And even though his son died from cancer, Dr. Grinspoon decided it's too important, and he started researching it as well. And in the same vein, today, Dr. Ethan Russo has been compiling the modern research that's going on around the world on marijuana. And he just was part of the discovery of the ancient Chinese marijuana that was found recently. These are the effects of cannabis on the body. So there are receptors in the brain and the nervous system that combines these cannabinoids in the plant with the endocannabinoids in your body. It dilates the blood vessels, and it speeds up the heartbeat. It brings down your body temperature, and it dries your body out. It stimulates the appetite, and it makes your digestive system work better and more comfortably, preventing nausea and vomiting. And it puts the body in a relaxed state of mind, and the body itself relaxes. It helps people to sleep better, and it prevents nightmares, and it helps people to move their bodies better. But most important for many people is the way it reduces pain. When your back hurts, if you have neurological pain. Neurological pain is pain that is not explained, such as when people have multiple sclerosis. And cannabis helps other drugs to work better, and so it reduces the use of other more dangerous drugs like opiates. And furthermore, it can be used topically on the body. That works as antibiotic and anti-inflammatory. Also, in the hemp seed itself, there are important nutritional compounds that makes people's immune system stronger, and those are the essential fatty acids and the essential proteins. This chart shows you the way that affects your whole entire body. When your body is done using cannabis, it's collected in your fat cells, and so that's why it's expelled through the urine and the feces. However, it stays in your system for a long time, but it's inert and not active. However, scientists believe this is why marijuana is not addictive, because it stays in your system so you do not crave it. To understand marijuana as doctors use it, you understand that you treat symptoms more than the disease itself. So it reduces the pressure inside the eyes. It relaxes muscle spasms and helps people with ataxia. Ataxia is when you try to move but your body won't move. And it's very good for chronic pain especially, but also neuropathic and acute pain. It also helps lift the person's spirits. It's also good for the aches and pains of older people. There are new studies that show it may repair nerve damage, that it helps to fight cancer tumors, especially the difficult to reach ones such as in the brain, and it kills the herpes virus. Because it has so many symptomatic benefits, it helps hundreds of diseases, and it provides an alternative to other drugs with dangerous side effects. Some people think this is one of the reasons it's illegal, because pharmaceutical companies would rather that you buy their pills than that you grow your own medicine. In the case of cancer and AIDS or SIDA, cannabis has often been the only medicine that keeps people going for 10 years or longer than they were expected to live. It helps with other problems too, like post-traumatic stress disorder. And since it helps with nausea and vomiting, it can be good for pregnant women. It can be good for people with the flu, and also people who are on chemotherapy or radiation therapy. People who have addictive problems may be concerned about the dependency issue, although it's about the same as for drinking coffee. More important are the false reasons why people don't use marijuana, because they're afraid of all the things they read in the newspapers. So I want to set the record straight. No one has ever died from an overdose of marijuana. Marijuana does not make physical addiction. Marijuana smoking does not cause lung cancer or emphysema. There are no negative effects known for the brain. The studies claiming that have all been proved wrong. There's no evidence that marijuana causes mental illness, and the connection may be that people use cannabis to treat their mental illness. There is no increase in car accidents among marijuana smokers. Some people use it to improve their concentration. Now I want to change briefly to industrial hemp. And the stalk has important industrial uses as well. This includes making paper, housing, textiles, plastic, and all cellulose products. Anything that you can make from cutting trees or using fossil fuels, you can make in a better, more ecological way with hemp. And it uses less fertilizers and less pesticides than most other crops. We can improve the soil. We can reduce the amount of carbon dioxide in the air. So here are some resources that are available, including my websites. And then go to the next one. These are some new or recently published works in Spanish that you should consider looking at. So I thank you in advance for all the good things you would plan to do with this information. These are good examples of why patients need to experiment and learn for themselves.
Estos me parecen buenos ejemplos de por qué los pacientes tienen que empezar a experimentar y aprender por ellos mismos.
Because most doctors today are locked into medical systems that are maybe not as effective as they should be.
Porque la mayoría de los médicos hoy en día están encerrados en sistemas médicos que no son efectivos.
But a patient knows well their own body.
Pero un paciente conoce su propio cuerpo.